For years, we've known most San Franciscans support mandatory treatment for people on the streets who are dealing with alcohol and drug addiction.
Mayor Daniel Lurie's new policies seem to focus on breaking down what many refer to as the homeless industry complex.
ABC 7 News Building a Better Bay Area reporter Leanne Melendez joining us now. Why is this problem so difficult to solve?
Oh my God, everybody asks me the same question. They always ask me, why is it that we spend so much money and it never gets solved? We're going to take it step by step because first, decades ago, we approached homelessness as this problem that would go away eventually without thinking that maybe building more affordable housing would be a good idea. And then the problem became like what I like to call the Winchester Mystery House, where a problem would arise and the city would add another department and throw more money at it. And eventually it became this complex, uncoordinated mess.
Homelessness was thought to be a temporary problem supported by churches and donations. At least that's what then San Francisco Mayor Dianne Feinstein believed in 1982. But with the lack of affordable housing and the deplorable conditions at shelters, homelessness gradually grew to become a complex problem in San Francisco, especially for the nonprofits that dove in to address the need.
They were learning on the job, so to speak, just as I was learning on the job. But I had to suffer through the process.
There was contention. By 2002, the city of San Francisco was spending $200 million addressing homelessness. Some homeless advocates berated then Mayor Gavin Newsom for wanting to implement a program called Care Not Cash. The idea was to take part of a homeless person's public assistance check in exchange for housing.
My argument is it will create less bureaucracy, more coordination, more collaboration.
Hang on to those words for a moment. Coordination and collaboration, because there has been so little of both. For years, some departments were addressing the issue of homelessness on their own, with almost no coordination.
You got one of those things you can put the needles in?
Yeah, we do.
For example, the health department focused on harm reduction around fentanyl. That was not in alignment with then Mayor London Breed's plan to reduce drug use. Still, health officials insisted that handing out kits with supplies like aluminum foil, pipes, clean needles help to prevent diseases and save lives. Critics argued that giving the tools to do drugs just helps to enable their addiction. Another example of the lack of coordination, the number of agencies and organizations that reach out to people who live on the streets. We've told you about the homeless woman who lives at a bus stop on the corner of Market and Castro Streets. Last February, we met her as an employee of the Department of Homelessness and Supportive Housing asked if she was willing to accept shelter.
The hot team will be by. They're in the Castro now. They'll be by and they can tell you about shelter that's available.
She declined. It would be naive of us to assume that she would accept their offer. But let's take a closer look at how the city of San Francisco spends time and resources on that one woman. First, the Department of Homelessness and Supportive Housing dispatches the homeless outreach team known as HOT to engage with her. It's been months. The health department also sends a behavioral health clinician and a peer specialist.
How many times would you say you reach out to somebody until you get that moment where they sort of come around?
As often as it takes.
Now we have a real drug addiction problem.
Randy Shaw of the Tenderloin Housing Clinic says in most cases that kind of approach hasn't worked.
And having homeless outreach teams, which basically if they saw drug users on the street, they say, everything okay? You want any services? No, I don't want any services. Okay, that's fine. What are we paying them to do? Just to say hello to people on the street?
We caught a HOT team member in a minivan asking a group of homeless people from afar if they needed shelter. The person never got out of the vehicle. In a 2023 performance audit of San Francisco street teams prepared for the Board of Supervisors, the report concluded that coordination is poor and none is accountable to the other department.
We have 9 different street teams spread across 5 different departments, and they aren't communicating as well as they need to be.
Mayor Daniel Lurie wants a more uniform approach to dealing with drugs and homelessness. He says the city will now scale back on the harm reduction model and restructure the street outreach team's work with the homeless. Daniel Tsai is the city's new health department director.
I can tell you the staff on the ground are really excited about this because folks want to be able to effectively help people on the street. You need to be able to do so in a coordinated way, and that's what you'll see in that very shortly.
We will take a hard look at our funding streams and our relationships with nonprofit providers to make sure we are getting the most from the $1 billion we spend on this crisis every single year.
Today, besides the Department of Homelessness and Supportive Housing, at least 5 other departments work with the homeless population. And there are more than 200 nonprofits working with the homeless that are funded by city agencies. And that's not all. There are 4 government bodies claiming to hold departments accountable: the Homeless Oversight Commission, the Shelter Monitoring Committee, the Local Homeless Coordinating Board, and the Shelter Grievance Advisory Committee. Despite the apparently unsolvable problem that it appears to have become and the massive workforce it has attracted, few are ready to call it the homeless industrial complex.
When a problem goes on for so long it doesn't get solved, people blame those trying to solve it. The villains are not the people providing the services.
Blaming the homeless response system for the homelessness crisis is like blaming firefighters for the California wildfires.
For those who have seen homelessness evolve through the years, they say right now, housing and proper treatment seem more amenable to San Franciscans than ever before.
I think they got a shot now. But that's treatment.
We have so badly misspent money. And I think now with the budget crisis and a different mayor, we're going to have a different approach.
A different approach is what most San Franciscans say they want. A 2023 poll found that people, for the most part, supported mandatory treatment for drug users who apply for services. Now, remember, a year ago, 58% voted to pass Proposition F, which supports that mandatory treatment. We also need the beds, by the way. We don't have enough beds for that treatment.
When you're talking about $1 billion, 200 different nonprofits, I mean, you could see why coordination and collaboration are in short supply.
And so needed.
Right.
I mean, because then we keep on, you know, if the left hand does one thing and the right hand does another thing, and there's no coordination, you're going to continue spending that money and spending that money. By the way, you know, we have a big budget deficit, and that's not going to continue to happen.
Maybe fewer agencies.
Have to shrink those.
All right. Thanks, Leanne.
Sure.